Friends, I Robinson. Welcome to our YouTube channel Star Science Robinson. Let's get into topic. Atrial septal defect, or ASD, or it is also called hole in the heart. As I go with the diagram, I just explain what is atrial septal defect. Normal opening between right and left atrium, which results in left to right shunting of blood, because in left atrium pressure is higher than the right atrium, so the blood from the left atrium, it will just pass through the atrium inner septum, that is primum, so through that it will enter into the right atrium inner, that is secundum. So through that hole the blood will pass from the left atrium to the right atrium, so there will be higher pressure created in right atrium, so it will pass through the right ventricles. From there it will send into the pulmonary artery to the lungs. There it will have or create higher pressure in pulmonary artery. And I deal with three classifications of atrial septal defect. So one is ostium primum, so second it is ostium secundum, and sinus venosus. So these three I'll show you in diagram. About the ostium secundum, now I'm showing you in diagram. Right now I'll start. So it is the most common type of atrial septal defect. So an abnormal opening in the middle of the atrial septum present due to the abnormal development of the septum secundum. Right now I'm writing here. So this is ostium secundum, which is inner part of our right atrium. So now I'm showing you about the ostium primum. It is present as an abnormal opening at the bottom of the atrial septum due to improper development of the septum primum, which is present inner part of our left atrium in atrial septum. Next we'll see about the sinus venosus, ASD. That is nothing but atrial septal defect sinus venosus, which is abnormal opening at the top of the atrial septum. So it means the pulmonary veins which will may or join to the superior vena cava or inferior vena cava, or we can go with the superior and the inferior vena cava will join in top of the atrial septum. Foramen ovale, which is normal in fetal development. So but when after birth it is abnormal if they have a opening still, and there will be mixture of the CO2 blood will go and mix with the O2 blood. So when we see atrial septal defect, so when there is a opening from the left to the right atrium, so the pressure in left atrium is higher, so the blood will shunt into the right atrium. So when it happens, pressure created in right atrium and the blood will flow into the right ventricles. From there it will go through pulmonary artery and to the lungs, where the pressure will increase in pulmonary artery because of additional blood from the left atrium to the right atrium. So we can just see that after birth the primum and secundum should get attached or close the foramen ovale, so that there will be no mixture of blood. But if it is not happen, then there it is called as atrial septal defect, so ASD. Sometimes at the first birthday the closure of the foramen ovale. If it is not, then it is a atrial septal defect. Thank you friends for watching our video. It's Star Science Robinson.